Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Mayong Adlaw Cebu, I'm Kriya Padilla-Ruleda from CDN Digital, and this is Maayong Adlaw Doc. In the last episode of Maayong Adlaw Doc, we learned a lot from our set of speakers at the Pink Forum, together with the stories of hope from our breast cancer survivors. You can always, of course, check our previous episode at the CDN Digital's Facebook page, website, or YouTube channel. Of course, as we continue the celebration of Breast Cancer Awareness Month, we're back for more health topics concerning this type of cancer that affects not just women, but also children and men. Okay, now before we head over to our main discussion, let's watch this video first about the hospital at Maayong Radiology Unit. The hospital at Maayong's Radiology Unit has radiologic imaging services that offer affordable yet high-quality assessments to help you detect, diagnose, and monitor different diseases and risks in your body. The hospital at Maayong is a home to diverse facilities to help patients receive healthcare solutions suited to their condition. The hospital at Maayong is not only a modern, clean, and safe hospital designed to prove hassle-free medical care for its patients, but they also provide only the best healthcare experience in Cebu, paired with world-class hospitality, accommodations, and amenities. And now for another informative topic for this episode at Maayong Adlaw Doc, we will be talking about breast cancer diagnosis. Now, breast cancer can strike at any age, which is why women are encouraged to consult a doctor and be informed of the necessary information, undergo the proper tests and treatment for early diagnosis, and understand the value of regular breast cancer screening. Now let's learn more about this topic from our guest doctor today. Our guest doctor for today is a graduate of Doctor of Medicine from the Cebu Institute of Medicine and has earned various training and certificates as well as seminars from local and international conventions and workshops. She has been a breast radiologist and sonologist at the hospital at Maayong since 2017. A medical doctor specialized in radiology, specifically breast imaging ultrasound, with years of experience guiding residents, training sonographers, and working with other staff in the department, in addition to interacting with key personnel both in the hospital and clinic settings. Let us welcome our guest for this episode, Dr. Carrie Ann Jorge. Maayong adlaw, Doc Carrie. Kumusta?
I'm okay. Thank you for inviting me here.
Yes, you're very welcome to this show. And since we're celebrating Pink October this month, no, look at Doc. She's wearing all the pink for both of us right now. Thank you for wearing pink, Doc. I really wanted to wear pink, but wala man ko'y pink. Yeah, it's Pink October. When we say Pink October, we talk about breast cancer, right? And you are a doctor, radiologist, sonologist. You do breast ultrasounds, no? For ano ni tawag ni, for detection of breast cancer. Okay. Since we mentioned the detection of breast cancer, what are the other ways actually, Doc, to detect breast cancer?
Well, women should come for a breast cancer screening. So this is usually done using a mammogram first, yes. And then ultrasound and breast MRI are supplementary already.
When we say breast cancer screening, what are covered there? What are the things that we do?
Okay, when you are being screened or in the category of a screening mammogram, you have no symptoms. You just come because you just want to get screened. So that's what a screening mammogram is. No symptoms. Whereas if you come because you have a problem, so it's a diagnostic mammogram. So there's a question that needs to be answered because the patient is feeling something.
Okay. So what's the difference between the mammogram and the breast ultrasound?
Mammogram is an X-ray of the breast. So it gives radiation a little bit, and it takes an X-ray picture of the breast. While ultrasound is sound waves So it also takes a different kind of picture of the breast that still gives information on any masses within the breast.
Pero, like say for example, screening lang, no? I want to get screened lang, I don't feel anything. Which one would you suggest I take, the ultrasound or the mammogram?
Well, if you're 40 years old, you should get the screening mammogram.
Why?
It has been proven that breast cancer usually starts in 1 out of 6 women at 40 years old. So it is advisable once you reach 40 to get your screening at least annually. Yeah.
Pero mammogram, no?
Mammogram.
Why not
yeah.
ultrasound, Doc?
Because ultrasound has not been proven to really save lives. It's mammogram that's involved in a lot of studies in which early detection through mammogram can save lives.
Pero di ba, Doc, if they find something through mammogram, they would still advise you to get ultrasound, no?
yeah.
Why is that?
Because since mammogram is the screening, so it's like a filter. So it's like yes or no, make or break. So if it's a no, then you get called back for additional tests to find out what that thing we saw in mammogram was. But if your mammogram is okay, then see you next year. Yeah.
Okay. So you mentioned if the mammogram is clear. So what's the earliest actually in the stage that we can detect a certain mass or let's say cancer, using the mammogram?
Stage 0. You have a stage 0 or the pre-cancerous state.
When you say stage 0, can we see something already there?
Yeah.
Is there
You can see
usually how
something,
big
yeah.
is that?
It really depends. Sometimes these come in the form of microcalcifications, like sand-like calcifications.
I see.
You can't touch this. This isn't palpable by your doctor or by you. So when it's at this stage,
You mean
they're probably
you cannot
very
touch
early.
this? Excuse me, Doc. When you mean you cannot touch this, it means you cannot, like when
Feel
you do
it.
your self-examination, you can't feel it.
Yeah.
Ah.
So when you detect it very early at this stage, there are so many treatment options. You don't have to lose your breast. So you can almost be like completely cured. Yeah.
Yeah, she's talking about losing the breasts
yeah.
because one of the more popular way of getting rid of the mass is actually the mastectomy,
Yes,
right?
yes.
Mastectomy is, can you explain, Doc?
When you remove the
entire
entire breast.
Oh,
Yeah.
and there's another one wherein we conserve the breast.
Yes.
Oh, what's that gonna, Doc?
It's a lumpectomy or breast conservation surgery.
Oh, and who are qualified or who can be considered candidates for breast conservation?
Well, there's a criteria. So the surgeons are more knowledgeable on what type of treatment or surgery they will use for the patient. But if it's more or less in a localized area, in a small area, you don't have to completely remove. There's an option to remove only a part of the breast or the entire breast. It's up to the patient and the doctor what they can talk about.
Yes, I had to ask that because usually when we talk about breast cancer, the thing that comes into mind is, oh, she has breast cancer. So gitang-tang na. They took out her breasts already. That's the reaction right away, which is not necessarily, diba? Because there are, again, as Doc mentioned, there are options. If it's localized, you can opt for, and if you're qualified, because there are criteria, as you've mentioned. If you qualify in the criteria, then you can save your breasts. No?
Yes.
Okay.
Yes.
Sige, Doc. What's the best age to start checking for breast cancer?
Okay, so if you're just at average risk for breast cancer, you can start at 40, as advised by American College of Radiology, American Cancer Society. They say start at 40 and then annually thereafter. But if you are high risk, like you have a first-degree relative with breast cancer, I mean close, like your sister, your mother, your daughter, then you're like in a higher risk for breast cancer. Also, if you've had breast cancer on the other breast, or if you've had a biopsy already with pre-cancerous lesion, so you're high risk. Or if you have genetic mutation like BRCA1 or 2, then you're also at higher risk. So you can talk to your doctor about earlier ways of, earlier time to get screened.
Okay. What's a genetic mutation?
Well, genetic mutation, the most popular ones are the BRCA1 and 2. Like if they have that, you get genetically tested. If you have that, then there's a possibility that you might get cancer, breast cancer along the way. So like what happened with Angelina Jolie, she tested positive, so she just opted to remove it. So yeah.
Hers is something very aggressive daw, no? Was it not
As
really?
she just had that mutation. Yeah.
All right. Sige, Doc. Now, I was just thinking bitaw, Doc, if you don't have symptoms, why would you keep on like getting mammogram? Isn't that sakit? It's painful, manggod? Right?
Yeah, there's some discomfort because your breast will be compressed. In between a paddle, you'll be standing, and there's a paddle that will compress your breast in 2 ways each, from up and down and from both sides. So the purpose of this is to spread your breast tissue so we can see in between if there are any masses.
If you don't have symptoms, like Doc, what age should we start na mo mammogram?
40.
40 lang
With or
yun?
without symptoms, yeah, because you're screening.
Okay, so prior to that, pwede dili lang yun?
Pwede
We
dili.
wait until there's a symptom?
Yeah,
Murag ginana.
yeah. Or you could go for the young ones to have ultrasound for screening, not mammogram.
Because I remember when I was younger, getting a mammogram, you have to have a request if you're below 40. But when you're 40, you can just go in there, no? Automatically.
Yeah.
Because again, it's when you're 40, you get a higher risk.
The risk starts at 40, according to some studies.
Okay. But, you know, I read also somewhere na nowadays, bitaw, women ages 30-something to 50, murag it's so random. They don't even have history of cancer. They just get breast cancer.
Yeah.
It's so random already.
Yeah.
Like the doctors now don't even know where it's coming from.
Yeah.
No? What can you say about that, Doc?
So that's why you just have yourself screened. Yeah.
Okay, Doc. In case, no, just in case you find something, like a mass, a little bit of mass. You say small calcifications for sa ganina, stage 0. What's the next step? What is the patient supposed to do next?
Actually, we won't know the stage until you get biopsied.
Okay.
So after mammogram, we see something wrong. If it's outright clear that this needs to be biopsied with no
You
need for
recommend.
ultrasound, just go get the biopsy. But if it's still unclear, so the patient will come back for an ultrasound where we will further characterize that abnormality. And if the biopsy is better done under ultrasound, so we will have it under ultrasound. If it's not palpable, providing that this is early, so you can't feel anything, so the surgeon just cannot go around and get a biopsy with their hands because they can't feel it. So it should be image guided. So since it's better seen on ultrasound and the patient is more comfortable in an ultrasound, whereas being pressed in a mammogram and doing biopsy, so we will do it via ultrasound. So when you get the biopsy, it's a core needle biopsy.
What's that? Core needle?
Core needle biopsy, yeah.
Do you do that, Doc?
Yes.
Oh.
Yeah, I do that also. There's a little local anesthetic, and then we get a few samples and send it for pathology, and then after a week, you get your diagnosis.
It's cool, right? Because it's like a harpoon, you.
Yes. It's like billiards.
Right. I've
Yeah.
seen one done.
Yeah. It's like that.
So, Doc, let's say, for example, there's this, the result bitaw of your mammogram. There's this, I forgot, it starts with letter B na
BIRADS.
BIRADS.
Yes.
Oh, the BIRADS.
Yes.
BIRADS 1, 2, 3,
Yes.
4, 5.
Yes.
Where do you base that? Like, why do you say, okay, this is BIRADS 5 with 95% of malignancy? Where did that come from? Because you just mentioned na you cannot actually tell whether it's cancer or not until you get a
the
biopsy. So why is there a 95% malignancy, BIRADS 5? Where does that come from?
The BIRADS is actually from an internationally studied categorization about the probability of what you saw being cancerous. So if it's BIRADS means Breast Imaging Reporting and Database System. So it's like a language all over the world. So if the patient needs a follow-up in another country or in another hospital,
they would understand.
We understand what we're looking for or what needs to be monitored. So if it's a BIRADS 0, meaning the mammogram is unclear, we need more tests. So the patient come for ultrasound or another special view mammogram if need be. Then if it's a BIRADS 1, it's negative. If it's you stick to the annual, you belong to the routine annual screening group. If it's BIRADS 2, you also belong to the routine screening. It's just a benign finding. We could just dismiss it. If it's BIRADS 3, then it's probably benign. You return after some time to just check, as time goes by, how that mass would be. Would it enlarge? Would it change shape? Would it have other characteristics that we should watch out for? Well, 4 and 5 are the suspicious ones wherein
what
you
makes
need
them suspicious?
the shape, it's irregular, it's spiky, or it on follow-up after BIRADS 3, it grew fast. Yeah, something like that. Or despite antibiotic, or if ever it looks like a infection before, nothing happened. So then you'll be 4 and then recommended for biopsy.
Is it safe to say now when somebody gets a BIRADS 5 and then it says they're like 95% malignancy, that's really cancer?
Highly suggestive of cancer. There is still that 5%.
Yeah,
it might
very
not
small.
be. Yeah.
Such a small hope.
Yeah. Yeah,
okay, so chances are it's really cancer because of the shape, no?
The shape, the character. Yeah, so if it's not cancer, we'll be surprised because we expected that mass to be cancer. So maybe we'll review it or discuss with the attending. Are you really sure we're not gonna go in and get more samples or something like that? Yeah.
Okay, so when we start with mammogram, and then you get the BIRADS 5, let's just say, okay, you get the BIRADS 5, and then you suggest for an ultrasound, and then you also suggest for the, you mentioned the biopsy, the core needle, right? And when it's all pointing to the same direction, na it's really cancer, okay, what are you supposed to, as the patient, what are the things that you're supposed to anticipate now?
Just follow what your attending physician recommends and what you both agree on. Yeah, your oncologist or your breast surgeon or your surgeon. Yeah.
Usually that is either to take it out or not. Are there even instances, Doc, na the patients won't allow the cancer mass to be taken out?
Yes, there are.
Do they survive?
I don't know. But they just come back for follow-up and it looks the same or it gets worse. But no comment on them because it's their choice. But for the, because you detected it early, there are treatment options which the oncologist would offer. Like, for example, getting chemotherapy first or neoadjuvant chemotherapy to shrink the mass before having surgery.
Why would we want to shrink the mass first?
I guess less traumatic or surgery, less extensive procedure. Yeah.
All right. I have a question here. This is mura siya funny, but I'm sure a lot of people have this in mind, no? So I will just ask anyway. They say, is it possible daw to develop breast cancer when someone unintentionally hits your breast? Trauma, in short, no?
Yeah.
Can it cause cancer?
Directly causing the cancer, I haven't read on a study that says it does. But if ever in that same area, there's
over
a
and
mass that
okay.
develops, it probably would be coincidental. So it's like a blessing in disguise that you came for a checkup, and then there was a mass to begin with. So it's like coincidental.
Okay. So there how you heard it, there's really no study yet connecting physical trauma to breast cancer. Okay. There's another one. Is a mammogram or breast ultrasound unsafe now? Because it's painful, man. So is it unsafe?
No, because as long as in mammogram you stick to your annual time, unless specified that we need to monitor something closely via mammogram. But the benefit outweighs the risk. The only risk I can see in mammogram is the discomfort from the compression, because as I said, you need to compress the breast so we can spread the tissues. And the more pressure, the thinner your breast will be, lesser radiation dose, and better quality of the image for interpretation.
You mentioned the thinner your breast, so if you have plump breasts, then it would be more painful.
Yeah. No, it's not
more painful.
Not more painful, but we still have to compress, not flatten. Sorry.
So it's
compress.
painful. Keep pa-compress, man.
It's not painful. I guess you can schedule your mammogram after your period, like 1 week after. So your breasts are tender or engorged.
Never get mammograms when your breasts are tender or engorged from your period,
or
right?
Going to your period. Yeah, you wouldn't want them to compress your breasts.
No, someone here is like imagining how painful it probably be.
It's
in the
100
mammogram.
to 200 newtons. I don't know how to liken that to something.
You're so lucky because you don't get mammograms. You don't get to experience this.
Yes.
Doc,
Yearly.
have we missed anything? Is there anything you want to tell our viewers about, getting themselves checked regularly for early detection of breast cancer?
Okay. Don't be afraid to get your mammograms, because when you're 40, you're advised to have your annual screening mammograms. Screening wherein you don't feel anything, there's no lumps, there's no pain, there's no nipple discharge. You just have yourself checked. Because early detection wherein you don't feel anything means that the problem is still very small or very localized and containable. And this is when treatment is most effective, with less morbidity, less extensive, and less costly as well. So, that's my advice. Don't believe that it's not good, or your neighbor saying that never again will I have a mammogram. So maybe they just didn't have the correct timing. Maybe they went there when their breasts were engorged, and communicate with the radiographer, the one who's gonna do your breast ultrasound, so that you know their expectation and their expectations for you, and everything will run smoothly and it will be less traumatic.
Thank you, Doc. But I want to go back to what you just said. You mentioned about the symptoms. What are the symptoms, because you mentioned like nipple discharge.
Yeah.
Okay. Can we talk about that? I think we didn't mention that earlier.
Before you get your mammogram or ultrasound, we usually interview the patient. So why we're here? Okay, screening. But if there's a problem, like it says there, are you feeling any lumps? Are you feeling any pain? Or any changes with your nipple? Did it start to go in? Or it's not pointing in the direction that usually
so that happens.
Yeah. Or is your breast hard? Or all those symptoms. Or is there something coming out of your breast, blood, or clear discharge, or yellowish, or anything that's unusual?
That's just unusual.
Yeah.
Those could be telltale signs of
symptoms.
Breast cancer. I see. Okay.
Don't wait for that to show. Yeah, just come for a screening mammogram.
So we have to do it regularly once we're 40.
Yeah, like include it in your annual checkup for your labs or your x-rays. Just have it included.
And I think for those, because we mentioned when you get to be 40, that's when you get a regular checkup already. But prior to that, I think it's still very, very safe to say na we can still check ourselves, no? So how do we do it, ganito? Can you show us how do we do the
I think that one is best for the surgeon or the clinicians.
Okay.
Yeah.
But we just what do you call it? Feel lang man, no? Around. When is the best time to feel that ganito?
I think after your period.
After the period.
When your breasts are very engorged.
Well, the reason for that is, first of all, it doesn't hurt much anymore.
And sometimes you have some cysts, which are like fluid-filled masses or pockets in your breast, which might be hormonally driven. So
during your period, they
they might engorge or not very sure. So better after your period when your hormones
when everything has settled in again.
Yeah.
So whatever mass you have there, you can feel them better.
Yeah, like when you're taking a bath or
yes.
soapy, you can just feel it around. Yeah.
Doc Carrie, thank you very much. We've learned so much from you today, and it's such a lovely sight to see her. Look at her. She's all in pink. Thank you, Doc Carrie, and we hope to have you again here in the show.
Thank you. I hope I helped.
Yes, thank you, Doc.
Thank you.
And that's it for our episode of Maayong Adlaw Doc today. Thank you very much for joining us, and please do share this episode to your friends and family so they may also learn from our discussions today. Now, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience in Cebu at the hospital at Maayo. Now, if you want to know more about the hospital at Maayo, please check out their Facebook page or their website, or better yet, call these numbers below. Now, again, thank you very much for joining us. I'm Kriya Padilla Roleda of CDN Digital. See you again next time.